Welcome to British Biomedicine Institute. Today we will explore overview of research designs applied in radiodiagnosis. In brief, a research question is formulated, methods are derived. To answer the question, data are collected and analyzed, and conclusions are drawn. Researchers attempt to learn the truth about the frequency of disease, etiology, prognosis, or therapy. There are two main categories of research design that can be used to obtain primary data and compare therapies, non-experimental and experimental methods. One of the major driving factors of research design is the effort to avoid or control error. Error can be divided into two general categories, random error and systematic error, also known as bias. Random error, as the name implies, is due to chance events that have the potential to lead to false conclusions. Designing a proper study question to address an area of clinical uncertainty is the first step in any research initiative, and one way to focus your research is to use the PICO approach: people, patients, or population, intervention, control or comparison, and outcome. The opposite of random error is systematic error, that is, introduced through inadequacy in the study design, subject selection, or analysis. Statistics are, for the most part, unable to compensate for systematic error. Avoidance of such systematic error, or bias, is one of the major challenges of research design. The opposite of type I error, known as type II error, is when we conclude that two populations are the same when in fact they are not. Unfortunately, the commonly reported p-value gives no information about the potential for this type II, or beta, error. Investigators can use descriptive or analytic research designs to conduct their research using primary data. Non-experimental, observational, and experimental research designs fall within the analytic category of designs. Diagnostic tests not only provide information about the likelihood of a particular diagnosis, but also determine the next step in the management of an individual who is being tested. It is thus important that diagnostic tests are accurate. Validity can be divided into internal validity and external validity, which is also known as generalizability. Internal validity refers to the extent to which the results and conclusions of a study actually relate to true events in the sample under study. Some of the biases and study design considerations described previously relate to validity. A cross-sectional study takes place at one point, cross-section, in time. The researcher identifies a sample, study participants, from a population of interest. All study maneuvers are carried out at one point in time. Disease and exposure are measured simultaneously. The optimal research study will be directed at an important, precisely defined clinical question, with the specified target population matched by the subject selection. The most efficient study design will be used, and the sample size will be sufficient to limit type II error to an acceptable level. During evaluation, we determine how well a novel diagnostic test, index test, performs by comparing its results against an established test, reference standard. The results from the two tests are compared at one point in time. Cross-section and statistical measures of diagnostic accuracy of the index test are calculated. Research is conducted on samples. We measure outcome or accuracy on a relatively small number of subjects. Yet the intent of research is, eventually, to influence clinical care. To achieve this, the research results must be valid on subjects other than those included in the study. Thank you for showing interest in British Biomedicine Institute Skilled Non-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.